Hey, everybody, it's Vaughn Dudarian. I'm the chair of the Oakland County Democratic Party, and we're bringing you another kind of a how-to video today with my friend Charles Gaba, chair of the Birmingham Bloomfield Dems, founder of ACAsignups.net, and a man who was described by Andy Slavitt as someone where until you hear it from Charles Gaba, it ain't true relating to the ACA. Charles, like I'm doing with all of our friends here, I want to ask you first, how are you and your family doing? How's everything going?
Well, we're okay. Thanks for asking. I hope you are as well. My wife and I both work out of the house anyway, so for us, our regular workday isn't that different. The big difference for us, of course, is we have our son. We have a 14-year-old son who, he's home all the time now, of course, and then we have a new puppy who is very rambunctious and eats everything. So that's a lot of fun. But other than that, I mean, we're hanging in there doing okay. Just social distancing, staying at home as much as possible. All that. So
Yeah, it's funny how the things that you add into your life as a little bit of fun and distraction wind up becoming really, really interesting when you're stuck at home. New puppies. We have a new puppy as well. So I got the idea to have this conversation because my wife works at the casino, and she got laid off when the casinos were closed. Mm-hmm. And when you look at the jobless claims over the past 2 weeks, you're looking at literally well over 1 million people that have filed for unemployment, and a lot of people had insurance that was tied directly to their employment. So right. For people that are out there who are looking at losing their employer-sponsored insurance, how does the ACA address that? What's out there for them right now, and what can they do?
Sure. And you may have seen a few headlines about this over the past week or so regarding something called a special enrollment period. There's been a lot of talk about that and some controversy about that. Basically, the way it works is this. First of all, it depends on what your income is. And when I say what it is, of course, there's a big difference between what it was until a few weeks ago and what it is now and what it's going to be for the rest of the year. And so some of this ties in with the big COVID response, the $2 trillion COVID response bill that was passed by Congress, with the extended unemployment insurance and the one-time checks and all that. Some of this ties in with that. But basically, here's the way it works. If you're in Michigan, and this varies by state, right, is the other thing, but in Michigan, thankfully, we embraced and expanded Medicaid under the Affordable Care Act. We expanded it to all residents earning up to 138% of the federal poverty line in income. And that's basically around $17,000 a year if you're single, with if it's just you, or it's around $35,000 a year for a family of four. Okay, and that is, if you have two or three in the household, it's a little different. But basically, that just gives you a baseline: $17,000 if you're single, $35,000 family of four. If you're below that threshold, then you're eligible for Medicaid under the ACA. And that's in Michigan, we call it the Healthy Michigan program. But that's what it's talking about. Now, until a couple months ago, that was a bit of a snag with that because we were supposedly imposing work requirements for Medicaid expansion under a law passed by the Republicans before Governor Whitmer took office. Fortunately, just before all of this hit, a federal judge shot those down and ruled them unconstitutional. So we are no longer have the work requirements, and thank God for that. And in fact, there was only one other state that was doing that, which was Utah, and they dropped theirs because when the pandemic hit, because it's unworkable. Right. You obviously can't have work requirements when everybody's getting laid off, right? So if you're up to those thresholds, then you go to michigan.gov/healthymiplan. That's the website for Healthy Michigan, and you can find out more information and enroll through there. Now, if you have children, if you're in Michigan, if your household income is up to 200% of the federal poverty line, which is around $25,000 a year, if you're would be up to around $51,000 a year for a family of four. then your children under 19 are eligible for the CHIP program, the Children's Health Insurance Program. The parents wouldn't be, unless at that level, but the children would be. So there's that.
Let me ask you a quick question.
Sure.
Let me ask you a quick question.
Okay.
So for these income requirements, these income thresholds, if somebody was working in a job up until the beginning of this month where they were making, let's say, I don't know, $54,000 a year, I think is the median household income. But if somebody was working at a job where they were making that much at the beginning of this month, then they lost their job, and for the foreseeable future, they're going to be on unemployment. They don't know what's going to be happening. Does that mean that they would not qualify for either Healthy Michigan or CHIP, or will that income threshold affect whether or not they can enroll in these programs?
Yes and no, and I was going to get to that in a little bit. It does get a little bit complicated. Medicaid eligibility is based on a monthly income. So, you could be making, a decent income up until March or April, and then,
Right.
It drops down considerably, of course, if you pick it up. But no, you can become eligible. It's based on what your monthly income is. So if your monthly income is below that threshold, that would break down to, that's something like around $1,400 a month, I believe, if you're single, or around $3,000 a month for a family of four. If your monthly income falls below that threshold, then yeah, you would be eligible. You would be eligible for Healthy Michigan, for however long you're in that position. But now we get, and I believe CHIP is also based on monthly income. I could be wrong about that. But for CHIP, if you go to michigan.gov/MIChild, that's the website for that, and you can find more information there. Now we get to the ACA plans. If you're above 138% of poverty, and for that, if you're between 138 and 400% poverty, which is that's around $50,000 a year if you're single, it's around $103,000 for a family of four. Then anyone can enroll through the federal exchange or through an ACA plan, regardless of their income. But it's a question of whether you get subsidies and whether you get financial help. So if you're
Right.
between 138 and 400%, then you would would probably be eligible for subsidies, and it's on a sliding scale. As your income goes up, then the formula is less generous as you go up. But here's the catch, and for that, what you would do is you would go to healthcare.gov, and then you would say, see if I can enroll, and here's where the catch comes in. This is where all the controversy you may have heard about is. Normally, there's an open enrollment period, which was from November 1st to December 15th, right? It's about a 7-week period each year, during which anyone can go to healthcare.gov and you can enroll. And if you're in those income range, then you may be eligible for financial help. If you're over that income, that 400% cap, then you have to pay full price. But that's during open enrollment. The problem is that we are outside of open enrollment. And during the rest of the year, normally you are not eligible to enroll. Basically, you get it during that by the deadline, or you have to wait until the following year, right? And that's actually not unusual. Changing employer plans. There's usually once a year open enrollment period where you can switch plans. Same thing with Medicare and so on. Sure. The problem here is, and so there are exceptions to that, because the reason for that is because you're trying to avoid people from gaming the system, and taking advantage by not enrolling for months or years, and then the second they get diagnosed, all of a sudden they now give me insurance.
Yeah, it's the whole thing about how I'm not going to buy health insurance, then I break my leg, and now I'm filling out paperwork.
Right, exactly. Wait, you don't want to wait. The auto insurance. There's a reason that you're legally required to have auto insurance. You can't drive around without auto insurance. You can't wait until after you crash and then buy insurance, right? That's the same principle. There are exceptions to that, though, because there are some things that happen in life that don't fit that timetable, and those are called qualifying life events, or QLEs. And if you have one of those, and those include things like losing your existing coverage, which is the big one right now, of course. But it also includes, like, if you get married, you get divorced, you have a child, you adopt, you get out of jail, you get out of the military, basically anything where there's, or if you move, if you move to a different state, then you're going to have to get new insurance, right? Because it's, Blue Cross of Michigan.
Different rules.
Right. So there's about a dozen different normal qualifying life events. And then if you have one of those, you have 60 days in which to go to healthcare.gov. And then you say, well, I've had this, and there's a list. And you say, well, this is what happened. This is my qualifying life event. And then you fill out, you go through the process from there. The biggest one is always losing your current coverage. People losing their jobs or whatever. Or maybe your income went up because you were on Medicaid and now you got a good job, and so now you're kicked off of Medicaid, but now you sign up. The problem right now is in a pandemic. Officially, anyone who's lost their employer-based coverage over the last few weeks, officially they do qualify for a loss of coverage special enrollment period, right? So they could go to healthcare.gov and fill that out and go through that process and and select a plan and get covered. What the controversy is that this system typically has nationally around 8,000 to 9,000 people per day usually use special enrollment periods. All right, that's across the whole country. That comes to over a 2-week period. That's like 70,000 people, 70,000 people over a 2-week period, right? I'm not sure if I'm doing that math right. Maybe
it's about right.
100,000, whatever. The problem is that about 10 million people just lost their jobs in the last 2 weeks. And I'm sure you've seen the headlines that the unemployment insurance systems are being overwhelmed, in a lot of states. Well, it's the same thing here. The problem with the normal special enrollment period is that under the Trump administration, this is a fairly new thing, they require documentation and verification. So what it means is you lose your job, you have to get your loss of coverage documentation, you have to upload it to the website, and then you have to wait for them to verify that you're not trying to pull a fast one, you're not making this up, and that this actually happened. And that it's a burdensome process. It's paperwork, it's red tape. Not everybody has a printer. Not everybody has, it can be there's a lot of hoops to jump through. And again, this is a system that was designed for, maybe 70,000 people a week, and you could have 700,000, maybe 7 million trying to, use it. So that's why there's been a call for a COVID-19 specific open enrollment or special enrollment period, where basically anyone who's uninsured can go ahead and sign up, and they're just not going to bother worrying about whether you're lying or not. They're just the assumption. It's a pretty good assumption that you're not.
So let me ask a question here, because I feel like this is a lot of what has prompted these sorts of conversations from my end is kind of trying to figure out like how bad are things actually. And when you look at what's been going on with the employment system, just in Michigan, just talking about Michigan, it's a couple 100,000 people that are trying to access the system all at once, and the system was not designed for that, and it's buckling, and they're trying to play catch up. So it sounds like we are maybe a week or 2 weeks, or we don't even know, away from the exact same thing hitting healthcare.gov, and because this is a federal system instead of a state-by-state system, it's going to fall on the federal government to fix this.
Yeah, and that's well, here's the thing. There's about a dozen states. Michigan is not one of them, unfortunately. There's about a dozen states that do run their own ACA exchanges. California, New York, Maryland, Massachusetts, Connecticut. They're all 12 out of 13 are blue states, or considered blue states. The one which isn't is Idaho. They run their own ACA exchange, except Idaho is the only one of those 13 which has not launched a COVID-specific SEP. So there's 12 states have. The federal exchange, healthcare.gov, which hosts 38 states, has not, and then Idaho hasn't as well. And there's been huge calls from all quarters screaming at healthcare, screaming at CMS, the Centers for Medicare and Medicaid, to go ahead and do that for this very reason, because you're causing a lot of paperwork and red tape for no good reason. Even the insurance companies, the insurance lobbies, the Blue Cross Association and AHIP, they have said, yeah, go ahead, because they're the ones who usually hate this. Like, they hate special enrollment periods. They hate open enrollment. I mean, they want it, if it was up to them, it would be just open enrollment. And if you're outside of that window, you're SOL, like,
Right.
don't get in, because they're the ones who it's all about the risk pool and adverse selection, and they don't want people, trying to take advantage. And they're the ones saying, for the love of God, open it up, because the thing is, you got to understand is, they know their year is screwed no matter what this year. Like, their numbers, all their assumptions, all their actuarial tables and all that stuff, it's all been thrown out the window. It's going to be a mess no matter what this year, and probably next year as well. So they're like, look, given that it's going to be a mess no matter what anyway, go ahead, open it up, let them enroll, let people get covered, and we'll sort that out later. So unfortunately, Michigan does not have our own exchange. I wish we did. And this is one of the reasons why, but we don't, and it would be a while before we did anyway. So people still do have the option of enrolling. Just understand that there's going to be some hoops to jump through. Now, I do want to get to the income issue, because we talked about that earlier. Here's some good news. First of all, normal unemployment insurance that people would be getting, that of course does count towards your income, right? So your income may be lowered, but you're still going to have some income, and that will be counted towards estimating whether you're above or below that 138 level for Medicaid, the 138 to 400 level for subsidies for the exchange, and so on. However, here's the good news. The CARES Act, the Federal Extension Act, it adds an additional $600 per week to it extends the period, right? I believe it doubles the period that people are eligible. For insurance, but it also adds an additional $600 per week to the uninsurance benefits, and that additional $600 a week, it does count towards the ACA subsidies, but it does not apparently count towards Medicaid. So that means that extra $600 a week apparently does not count towards your Medicaid eligibility. So, like, let's say that your normal insurance puts you at $15,000 a year, and then you're getting that extra $600 a month. Apparently, that won't be counted. So, like, you may still be eligible for Medicaid even if your actual income is over that threshold. There's a lot of people who may still be eligible for Medicaid expansion.
So let me ask a question and kind of go to like a practical, somebody's watching this and they're trying to figure out, they're losing their health insurance. They don't know what to do. What would be the first thing you would tell, just a normal everyday worker who they know that, let's say their insurance is going to run out at the end of the month. What's the thing they should do today?
Okay. So they know like I said, Medicaid, Medicaid and CHIP, you can enroll in any time during the year. There is no, deadline. That's because it could change month to month. You could be on one month, off the next month. So that's open all year. So, I would still go ahead and get the process started, because you would have to contact, the state Medicaid office, department, and start enrolling. But you don't, like, there's not like a time window for, if it turns out that you're looking at an exchange plan, then you have 60 days, and that's 60 days, I believe it's 60 days before or after. So, like, you don't have to wait until your insurance runs out before the 60 days starts. So it's coming up at the end of, let's say, the end of April, that you're going to be losing your coverage. I would go ahead and go to healthcare.gov and, plug in, it'll say, like, see if I can enroll, choose the special enrollment period. And I would shop around, I would take a look, and you fill in your expected income, your new expected income for the rest of the year. And then it'll let you know what type of subsidies you're eligible for and so forth. And so I would start that process now. But again, it's important to understand that because of this whole thing where the additional money, the additional $600 a week counts towards your ACA income, but it does not count towards your Medicaid income. There's going to be a lot of people who think that they're not eligible for Medicaid when they actually are. And for a lot of people, Medicaid is actually a better deal than even a heavily subsidized ACA plan. So I would actually visit both. I would visit both, the Healthy Michigan website, contact them, as well as visiting healthcare.gov to find out, because that way you want to see what which would be better in your situation. I have gotten conflicting information about that one-time $1,200 check that people are supposedly getting. I've heard sources that say that it does count towards your income, and some that say that it doesn't. And my understanding is that it would not apply, which is a good thing. If you're trying to keep you actually want your income to be lower for purposes of what you qualify for.
Right. And I think that, this would be my take on it, is basically, if you think you're going to get the $1,200 check and you're worried about health insurance or whatever, worry about that when you get it. Because.
Yeah. Well, that's the other thing, is that now I'm hearing stories. I'm sorry, go ahead.
My take on this would be that, if you're somebody that is right now looking at losing your health insurance and you are worried about how that $1,200 check is going to affect you, take care of the health insurance now and worry about that check when you actually get it. Some people won't get it until, could be May, could be September. You worry about that when you get the money.
I agree with that, because the thing to keep in mind about the exchange subsidies is that the worst thing that can happen, if you underestimate your income a bit, the worst that can happen is that next year when you file your taxes, you may have to pay some of it back. But for a lot of people, for most people, I don't think that's going to be an issue anyway. And even then, the enforcement mechanism on that is pretty weak. Like they can reduce your tax refund, but they can't, you're not going to go to jail or anything like that. It's not, so, and who knows? They're working on this they're supposedly working on a fourth response bill right now. And who knows what they're going to throw into that as well. There may be some additional, they might waive that sort of thing. Who knows? So yeah, I would say those are basically the options to look at. The thing again is that for Medicaid, it's based on your monthly income. For ACA subsidies, it's based on your annual projected income. It's what you expect to earn for the full year. So again, the first quarter you might have earned a
couple $100.
Well, I'm saying that the first quarter of the year you might have earned more than if you multiply that by 4, it might be too much to qualify for the subsidies. But now for the rest of the year, it's going to be a lot smaller. So, or for hopefully not for the whole year, but who knows? So yeah, that's an important distinction for people to make. So yeah, I would visit michigan.gov/healthy-MI plan for Medicaid, michigan.gov/MI-child for the CHIP program, and then healthcare.gov, for ACA policies. The people who are the only people who are really, where it's really going to be an issue are people who earn over that 400% upper cap for subsidies, because that once you hit 400% of the poverty line, once you go over that for your annual income, you're eligible for nothing. And that's one of the big problems with the ACA, which I hope they'll fix, but is that it goes from whatever your subsidies are down to zero, instantly. However, the sad part is that most of the people applying are, their income is going to be dropping substantially for the year in the first place, which means that there's going to be a lot of people that's not going to be an issue, because their income's no longer going to be over that anyway.
I feel like the Venn diagram of people who are losing their insurance and still making over 400% of the poverty line it's a pretty small overlap.
Well, who knows? but yeah. Well, you got to keep in mind that it's based on income, not wealth. So, you could be making $1 million a year, and then you go down to zero because you lost your white collar job. I don't know, that's happening. But, and technically speaking, your income is still below that line. So,
All right. So I'm going to ask you kind of like the go-to journalist question first, sort of a last thought. Is there anything that I should have asked you about regarding the ACA or healthcare or any of this sort of stuff that I didn't? Anything that you want to try and throw out there?
Well, I'll just say this, all of this discussion about, oh, this is so complicated. And, I know that obviously, of course, in Democratic circles, especially, there's a big, debate about, Medicare for all and universal coverage and all that. And of course, that issue has been raised again now. The thing to keep in mind about this is that whatever the next big thing is, right, whatever the next big move forward in healthcare is, it's going to take time, even before all this hit. There is a lag time between when you start the process and when when the bills and they have to be debated, and there's all this logistical stuff and rule writing and all that has to take place. So you're looking at several years before a lot of these big major sweeping changes could be made, no matter what it is, whether it's a Medicare for all, single payer system, whether it's a public option. Some of these things are going to take a few years no matter what. So that is, you can't just say, well, see, this proves we need Medicare for all, do it right now. Well, no, it's not going to happen right now. Right. So that would be the other big issue that I've been seeing a lot lately.
All right. Well, we've been talking with Charles Gaba, the founder of ACAsignups.net. Thanks a lot, Charles, for coming on today. Thank you so much for all your help. If you watch this video all the way to the end, please make sure that you go and sign up for our email list at ocdb.org. You can follow us on our Facebook page. Check out our YouTube channel. We have a couple new things that we have in the pipe there. Also, I'm going to throw in there, because Charles worked very hard on it, make sure you download our app. And if you can throw us $1 or $2, set up a monthly donation, we would certainly appreciate it. We're trying very hard to find ways to be helpful and useful to the people in the community. So thanks again, Charles. I appreciate your time today. And we're going to let you go. Stay home, stay safe, and we'll see you soon.
Thank you. Thank you for having me.